I got the idea for the Pial Synangiosis operation from what happened with our early efforts with the operations that were initially proposed for this illness. When we operated on the children and studied them after the operation with an arteriogram to see whether there was new growth of blood vessels into the brain, these children weren't having any results at all. And I felt that I knew why this was happening, that these are some technical issues which perhaps are a little esoteric, but they have to do with the fact that these blood vessels from the donor source have to get through a series of membranes before they can join up with the blood vessels on the surface of the brain. And all those membranes, I felt that unless all those membranes were opened up and one took the donor artery and actually secured it to the surface of the brain so it stayed in contact with the brain, these new blood vessels would not develop. So what we attempted to do with our surgery was to open up as widely as we could all of these membranes, and then to take that donor artery and actually suture it down to the surface of the brain with these tiny, tiny sutures. They're 10-0 nylon, which is about a third the thickness of a human hair. They're very, very small, and you can barely see them with the naked eye. Luckily, you know, we use the microscope for this so that we can do the surgery effectively. But I think it was at that point, that was the real breakthrough in terms of turning this operation into something that you were hoping would work into one that you thought we knew would be extremely reliable and effective.